Good morning. This is Dr. Ivan, the Smile Doctor, and the topic I want to talk about today is bruxism. I did an informal survey of about, I'm going to say about 40 or 50 patients at the Midwest Dental Sleep Center, where I am a diplomat providing treatment for sleep apnea and upper airway obstruction. And what I find is there's so many patients that grind their teeth and don't know they grind their teeth. And that shocks me. I think bruxism is, and bite disorders in general, is probably the number one problem I see dentally after 35 years of dentistry. It's the most destructive thing there is, more destructive than cavities. I see people, for instance, like my sister, who was so afraid to do veneers and restore her teeth because she thought we were drilling off teeth. And I told her, I said, we're not actually drilling off teeth. We're going to add back teeth that you've ground down over the years. And I'm going to say she probably lost as much as 20 to 25% of the length of her teeth because of this terrible disease. I consider it a disease. The causes of the disease are much more controversial and harder to define, whether it's an iatrogenic thing or is it something that is triggered by the way our bites are. And that's another topic. I'd love to get into some orthodontic, orthognathic issues, but today, just realize that of the 40, it was 40-something people that I interviewed and asked them if they knew they grinded their teeth, and I asked them also if they had gone to their dentist within the last 6 months, and of course, most people say yes. We know that that's not necessarily true. The insurance industry has statistics on how many people miss their 6-month appointments, but it's quite often. And in my office, 90% of my patients come at least 3 times a year. So I have a very highly educated dental IQ for a dental population. But in general, if you go twice a year, you're at least part of the 50% of the population that goes to the dentist and is at least minimally taking care of your teeth. So of those people, 90% of them, 90% of the ones that I identified as bruxers did not know they were bruxers. To me, that's a travesty, and that's something that we need to correct in the dental industry. Now, as I spend time with my fellow dentists, first of all, I am the most critical person of my dental profession, but I will tell you, I love dentists, I love what I do, and dentists are some of the greatest, most ingenious, innovative people. So many of them are inventors, and I love dentists, but I'm critical of those in my profession because I see dentistry practice at such a mediocre level when we could be practicing it at a much higher level. I understand that there's access to care issues, and there's dentists who work on Indian reservations in the middle of New Mexico that may not be interested in doing, quality restorations, and minimal care is all they're doing. I understand that. But in general, when you live in a nicer community, and many dentists, we have to go to communities that people have money to pay for our services and have teeth. So you're going to see dentists that are going to be, you hope, are a little more educated and are getting some additional training. And dentistry does not do a good job of training dentists beyond dental school. Yes, we're supposed to get 32 hours every year and a half of continuing education, which to me is a pittance. I usually routinely do 100 to 150 hours a year, but it doesn't make you go through training programs. And with no new residencies and no new specialties in dentistry, there's really no motivation for a dentist to go on and get further training. So your typical dentist is a drill, fill, and bill type of dentist, and crown a year club type of dentist is what we call them. And they're fine, they do a good job, but there's just so much more to dentistry than that. And the one thing I would like to see more of is diagnosing occlusal problems, bite problems that can lead to TMJ and worse. And as a sleep dentist, I find so many patients with jaw issues. and that could be easily corrected with some minor dental, or how about just protection, wearing a night guard. 75% of my patients wear night guards, and that's because we cannot control what we do when we're subconscious and or not conscious of what we're doing. We could be very well awake, not necessarily asleep, but we just don't know what we're doing. So that's the topic for today. Ask your dentist about bruxism, and I'll talk to you tomorrow. Bye.